The honourable member for Lacombe-Ponoka, followed by Innisfail, Sylvan Lake.
Thank you, Mr. Speaker. Last week, I raised the question of chronic disease management to the Health Minister. His answers, quite frankly, left much to be desired. The Auditor General's report was very clear in outlining that the government has no system in place that assesses chronic disease management needs, making it difficult to match its services with demand. To the Health Minister, exactly what system will you put in place to determine the demand for chronic disease management services across our province?
The honourable Minister responsible for the environment.
Thank you very much, Mr. Speaker. As I mentioned in one of my previous answers, this government is committed to managing chronic diseases through what is the Auditor General identified as one of the most effective tools, and that's through the primary care healthcare system. The PCN evolution work in the coming weeks and months includes enhanced services such as extended hours, same-day or next-day patient access, notifying patients when the PCN they belong to and services and which one they belong to, and the services in which the PCN provides, as well as improved continuity of patient care.
First supplemental.
Mr. Speaker, given that the Department of Health has not renewed the Physician Office System program to support the enhanced use of electronic medical records by physicians who currently have them, and given that, Mr. Monteith, Chief Delivery Officer of the Ministry of Health, said yesterday at PAC that the system reform will be difficult because physicians are independent contractors. Under the leadership of this Premier and the government, it has wasted hundreds of millions of dollars on these systems, and still a universal electronic medical recording system has not been developed. When will it be done, Minister?
Honourable Minister.
Mr. Speaker, as was rightfully identified, one of the biggest barriers to this is trying to work with our frontline healthcare providers, including the doctors. We will continue to work with them and encourage them and provide them the proper incentives and frameworks and platforms to continue to move forward with a proper electronic healthcare record. Mr. Speaker, again, there is no excuse in today's day and age not to utilize technology to the best of its ability to improve healthcare outcomes.
The honourable member for your final supplemental.
Thank you, Mr. Speaker. The Minister is right. There is no excuse for this government's lack of work on this file. The Auditor General has also noted that the Department does not currently have a structured approach or business model to deliver chronic disease management. Again to the Minister, given that we spend more on chronic diseases than the entire Department of Education, how is it possible that this government has no plan to effectively manage chronic diseases in our province?
Honourable Minister.
Mr. Speaker, the honourable member is right. Being able to manage chronic diseases will certainly help us with trying to bring down the costs of healthcare expenditures in the province. The more that we can keep people healthy and out of the doctor's office, out of the emergency rooms, out of the acute care system and the long-term care system, the better it will be for Alberta taxpayers. And that is certainly an objective that we have as a government, is to manage those issues in a way that does so with the appropriate financial considerations.